Hello, I'm Dr. Tracy Wallace, and this is my wife, Dr. Debbie Wallace.
Welcome to True Health Doctors. So today we're going to be talking about the coronavirus, COVID-19, as it has been named, because this is just a 2019 strain of the coronavirus. This has actually been around since the 1960s. So the coronavirus isn't new, but this new novel strain, the COVID-19, is what is now a pandemic. So a lot of people have been saying, this is just a hoax. This is not something that's real. But now we know that it isn't, because currently more people have died of this disease than even died at 9/11. And we know that was a big deal. A lot more people are going to die from this disease because we don't yet have it under control, and there is no treatment yet for this disease. So, Dr. Wallace, since you have been seeing patients, and you know more about it, tell us a little bit more about what are the symptoms that we need to be concerned about?
Well, the symptoms for COVID-19 can be very general. We say that it's flu-like symptoms, And so we're talking about things like cough, fever, shortness of breath. Those are some of the most prominent features, but you can also have sore throat. You can also have things like a change in your sense of smell or taste. You can have stomach issues as well. Some people have diarrhea. But the interesting thing about it is when you're talking to different patients, boy, I tell you, no two patients have quite the same symptoms. And I've had some people with very mild symptoms, and as we know, one of the most typical things can be no symptoms at all.
Okay.
And so it's very hard to sort of pinpoint. I would say of all the symptoms, the ones that probably the most worrisome, that kind of hit me the most is the shortness of breath. Because I've had some people say, boy, I felt short of breath like I never used to before. I was just walking around the house or going up some steps, and I just had some incredible shortness of breath. So what's one of the most prominent features? But then you talk to enough people, there's a bunch of people, no shortness of breath, whatever. In fact, I've had some people who didn't have much of a fever either. They just didn't feel well, and they know they'd been exposed to it, and so they decided to get tested. So the symptoms can be very, very different from one person to the next.
And as you said, there could be no symptoms at all. So
yeah, that's what makes it so challenging. And so you could be in a room with 5 people who all have COVID-19. 4 of them could be just fine, and 1 could be having very severe symptoms. And you just don't know. It go from one person to the next. What we do know is people that are immune compromised and the elderly are particularly at risk for having a more severe form of it.
Okay, so who are immune compromised people?
Well, immune compromised, you're talking about people who have things like diabetes, have heart disease, have lung disease, have kidney disease, lupus, people that are on immune suppressants, people that have had transplants, things like that. But guess what? And I would leave it to your expertise. A healthy person can be immune compromised as well.
Yeah, sometimes people don't get that. You don't have to have these diseases to become immune compromised. If I haven't been sleeping and not eating and taking care of my body can become immune compromised.
Yes.
And so that's why it's so important, especially now, that we pay attention to these things. This is really, really important.
I get so concerned about some of these healthcare workers because even wearing the protective equipment and all those things, working those long hours and not getting proper sleep, those things compromise your immune system.
Absolutely.
And make them more susceptible to this virus. Yeah. And we have people say, oh, I'm not immune compromised, I should be good. And it's like, well, if you don't get enough sleep, if you're not eating well, not drinking enough water, all those things can compromise your immune system and make you more susceptible to the virus.
Well, we also know that children are less likely to have severe symptoms. And of course, you see a child, you naturally want to pick them up and hug them and kiss them. And this is one of the big reasons I think they've said schools have to be closed, because we realize children inevitably, in fact, you used to tell me when your patients come from seeing their grandchildren.
Yes, they used to always get sick. That was one of the things. That was almost like a byproduct of visiting the grandparents. They'd come back, the grandkids. They'd come back sick, and and unfortunately, even among young people, aren't very concerned about COVID-19 because they recognize that it's really not affecting the young people. Now, there are many exceptions to this, as we know, because, again, as we said, anybody can be immune compromised for many different reasons. And so there are exceptions, but generally speaking, it's older adults and definitely those in nursing homes and these kind of places that are getting this disease. But in order to take care of the problem, everybody has to be working together in order to prevent it.
Yes. So we've talked a lot about what are some of the symptoms, but is that it? Is there any hope beyond, what if I do get this infection? Is there anything? Well, we'll come back and talk more about that right after these messages.
Welcome back. We're talking about COVID-19. And we have very limited options for people who have COVID-19. And we're telling many patients that if you have COVID-19 and your symptoms are mild, just to go home and self-quarantine for 14 days or so until you start to feel better. If it gets really bad, then you go to the hospital and you may need to be helped, assisted with breathing and those kinds of things. But, it turns out there's a lot more that you should be doing than just, if you have mild symptoms, just going home and self-quarantining. So what are some of the things that you should be doing or you would recommend for somebody who has mild symptoms but suspicious or tested positive for COVID-19?
Actually, I recommend this for everybody. Because the fact is, anyone, we just said, can be asymptomatic. Anyone can have the disease. So you don't know if you may have it or have had it. We don't even know. There's no test yet for even to say, okay, you've had it. So the fact is, we don't know. So I recommend for everyone to take these preventive measures. It will both prevent you from getting a severe form of the disease. Because really, how you want to look at this is that there's stages of this disease. There's stage 1, that is more when you're acquiring the disease. But it takes a while before the body, develops more symptoms and so on. It just doesn't happen overnight. It takes days, in fact. And so stage 2 is where you could really have an effect. In fact, one story I heard was that a lady was older, 71 years old. She had had the symptoms, but they weren't sure. And so at home, they were all taking vitamin C. And they were taking doses of like 20 grams of vitamin C. But she wasn't so necessarily taking it because she didn't too believe it. You know how it is. Some people will buy in fully and others don't. And so she wasn't being as vigilant. And so her disease progressed. But everyone around her, obviously, were exposed to it. But only she progressed. And then she got to the hospital. They tested her. They tested the others. They didn't have it. But she had it, and it had now progressed. So she was admitted to the hospital. And they said there was very little that they could do for her. In fact, they put her on getting medical treatment for breathing because she'd gotten that far gone that the daughter finally said, "Can you please give her vitamin C for me?" And the doctor reluctantly agreed to it. And it did, in fact, help her. She actually recovered with just that, because there's really not else that they're doing. So not saying this is a panacea for everything, but this is something that doesn't cost a lot. It's not hard to do, and it's not going to hurt you. Vitamin C can never be toxic because your body eliminates any excess. So you don't have to worry about you taking too much vitamin C. There's no such thing. Okay, so you can take as much as you, I've seen people take 1,000 milligrams, just overdo it. I've known of that, and that it has helped people, for instance, with the flu and so on. So vitamin C especially is one of those things that you can do to help build up your body. Another vitamin that's very important in this is vitamin D.
Yes, I was gonna
Vitamin
mention
D
that.
is
Yes.
extremely important. And you know, there is a population of people that seems to always be very low on
Yes,
vitamin
yeah.
D.
My experience over and over has shown that among African Americans,
African
the vitamin D is low, more than 50% of them. And now that's not, don't take that to the bank as far as scientific studies, but whenever I test African Americans, more than 50% of the people that I test, they're low in vitamin D.
We tend to not really go out in the
Exactly,
sun.
exactly.
So that's part
We're
of
not
the
wor-
problem.
we're not working on
We don't-
tans, most of
We're
us,
not
most
working
of
on our
us.
tans,
No,
right?
most of us.
So,
Yes.
so we tend not to be
Yes.
getting that vitamin D in our, and that's
Yes.
very important. And it doesn't take that long to. People think they have to be in the sun for all day. No, just 15 minutes of being in the sunshine is enough to give you the vitamin D that you need for the day.
But I'll be honest, right now with all that's going on, a lot of my African American, if they ask me, what can I do? I'll say, take some vitamin D. Even without even testing their level,
Yes.
you can almost assume that they're low in it, and it's not going to hurt either
It's not
to
gonna
take an
hurt.
extra 1,000 or 2,000 units of vitamin D on a daily basis
Right.
to help to boost the immune system.
Absolutely. So you can take that supplement if needed. But also, it's a great idea to go out in the sun and get some exercise while you're
Yes.
out there and get some fresh air. Because guess what? All of those things boost your immune system. So your immune system can be strong. I mean, you're home anyhow. Take just a few minutes and go outside and get a few minutes of fresh air, sunshine, that vitamin D, and get your exercising. That's what I've been doing. And I'm telling you, it makes me even feel better.
Yes.
And that's a great thing because it also helps you to not be depressed. And it's a lot of depression going on right now.
Absolutely. Depression and anxiety are running
Yes.
rampant right now with all that's going on.
With this
Yes,
pandemic,
yes.
you know,
Go outside, get some fresh air, turn off the news. Don't sit and watch that news all
All
day.
the
That'll
time.
make anybody
Oh.
depressed and anxious right there.
Yes.
Got
All
to turn
the-
off that stuff. Go
yes,
outside and
all
get
they're
some fresh
talking
air.
about is the problem, the
Yes,
problem. Nobody's
yes.
talking about any solutions.
Yes.
So yes, get away from that and get some exercise. Even if you're inside, even if you don't go outside, it's very, very important that you get exercise. Exercise is one of the best ways to boost your immune system. So folks, even if you can't do much because you have knee problems or joint problems, you know, even if it's just walk in place, even as you're sitting down, doing movements, just simple things. The
Yes.
body doesn't care where you are, it sees activity. It doesn't matter if you're just doing, you can do sit-ups just doing this. You can get those muscles going. There are so much that you can do. Even sitting down, you can get exercise. And getting up and walking and just doing some other things that are getting your body active, it releases endorphins.
Yes.
And endorphins I just love because I say those are the feel-good drugs that I love that don't make you have any side effects. They just make you feel good. So this is why exercising is so important. Don't think about a gym. Of course, they're all closed now anyhow. So you don't have to go to a gym to do this. Do it just because you're right there at home and I can do a few minutes of exercise.
You know, some people say, I can't just be doing this all the time. It's like, well, put on something on the TV or put on some music, not the news, something funny or something
Yes.
entertaining, and then do that while you're watching
While
that
you're
to help
watching.
to pass the time.
Yes.
Because it's very easy for us to turn on a TV and half an hour has gone by. We don't even know where the time gone by.
Yes, but
that's the
walking
way
in
to do it.
place as you're
Yes.
doing that,
Yes.
or listening to some music and just enjoying some wonderful music can
Yes.
help you to feel better and to have a more positive outlook. It is not the end of the world. Believe it or not, we are going to get through this.
Absolutely.
We are going to get on the other side of this.
Absolutely.
And we will survive, but we need to take care of ourselves.
Yes.
We need to make it a priority that we
Absolutely.
eat right, exercise, and drink water. Now, I can't emphasize how much drinking water is important. It is very much a thing that, you know, washes your inside out. It helps you to get rid of toxins.
Did you say juice?
No, I
Oh,
said water.
Okay, just checking.
Yes. I know people love to think water, juice is good enough.
Yes.
It's not. It's not, folks.
Plain
And
water.
Plain water, and it's full
Okay.
of sugar. That's,
Okay.
you know, we don't want to gain more weight, okay? While we're home to eating all day long. I know that's the temptation as well.
There's no substitute for a good glass
Water.
of water.
Water is a solvent, folks. That's what it is. It's a solvent. Think about you ever taking a bath without water. Have you ever had a bath and something happened and water stopped? You will never be clean with just soap. It takes water. It's a solvent that washes away. That's what God made. That
So the
water.
same thing that washes the outside washes the inside?
It washes the inside.
Okay, there you go.
Absolutely. That's
right.
the point
There
of
you go.
water. And that's why you need pure water. So I know some other people have told you you don't need water because
Yes.
water is in foods that you, that's nonsense. That's not true. Don't believe that. You do need water because it is a solvent that washes your inside, and we all need it. Now, there's one last thing I want to share with y'all that boosts your immune system. And this thing has actually been proven with another pandemic, the 1918 flu,
Ooh, what happened there?
that it worked. It is a very few people know about this, but it's something called hydrotherapy.
Oh,
Hydrotherapy is hydro for water therapy. It's actually water therapy. So again, this is not something that's expensive to do and that people can do. They found out that people who actually had hydrotherapy were able to make it through. And again, back then, they did the same things we're doing now. We all wore masks and all that to prevent the spread of that flu. But they found out that people who had hydrotherapy, what that involves is very simple, and it's something that I recommend that we all do, regardless, even when this is over, because it helps your body. What it does, it stimulates your body's natural killer cells. They activate the macrophages and other killer cells within your bodies to actually fight, and that's what you need to be able to overcome any kind of disease. And so these hydrotherapy, one in particular, I'll tell you, is where you're alternating hot and cold water. It's actually very simple. Now, you can, you know, if you went to somewhere where they did it for you, they would have a whole bath full of ice and another bath is just hot water. Not to burn yourself, but as hot as you can actually withstand it. And I've actually done it in the bath as part of my studies. And it was amazing. You went into that hot, and you were hot. I mean, you could even sweat. It's so hot. And then you got out and you went into the cold ice water. It was so cold that you could hardly stand it. But you alternated between the hot and the cold. You know what would happen? As you did this the second time, the hot and the cold didn't feel as hot. And the third time, somehow your body is able to regulate itself with such fascination that you actually, it still was a bit hot and a bit cold, but not as horrible as it felt the first time you did it. Your body actually starts to already regulate itself, and then it goes beyond that. After you just do this for 3 times.
now is there a simpler way than having 2 baths, one hot and
No,
one cold?
absolutely, because I only did this in my class when I studied this
Okay,
hydrotherapy. Never again. I simply do it, and I recommend to people that you do it right at home. You just have the hot water pipe and turn it to as hot. And usually after you bathe, after I take my bath, and I'm now clean, just before I leave the shower, I turn the pipe to as hot as I can bear it, and I stay under it for a minute to 2. And then I turn the pipe to as cold as you can tolerate it. And you stay on there for just about a minute. And then you turn it back to the hot for 2 minutes, and then back to the cold for just a minute. 3 times you do this. And when you get out, I'm telling you, folks, I do this especially during the wintertime, because in the wintertime, my feet will be freezing. And then I will take that shower and do my hydrotherapy, hot and cold baths. And I will come out of that, and my body will be so warm. I'm like, how was I freezing before? I am so warm that I'll be even like, this place is hot. I'm like, just a few minutes before,
And that stays with you a while?
it stays the whole night.
Oh, okay.
The whole time, because the body is able to, it's able to better regulate itself now that it has gone through almost like this, gearing up. It's gotten through this test, and so, it's now ready, and it's able to adapt better. So it's the same thing with these diseases. It's able to fight harder, to be able to work better, because the body actually turns on something there. The hormones, these natural killer cells that are in our body is working better. And it's just amazing that just doing water, just using water therapy can actually have such a profound effect. And was proven with the 1918 flu that the people that were sick, when anyone that went through this treatment actually survived. Nobody, they said none of the people that they documented that went through the hydrotherapy actually succumbed to the virus then. So, it's hopeful. I'm not saying that this will be the panacea again, but if something has worked that well, it's worth trying, especially this is not something that's going to cost you thousands of
Yes, I was
dollars.
about to say that. It's cheap.
It's cheap.
Very inexpensive.
And I'm
right.
telling you, as someone who has tried it myself and found it to be effective in helping me just to feel warmer during the winter, it's worth it. It is a wonderful thing that I recommend to you. So this is simple ways that we can boost our immune system so that we can fight this, so that it doesn't progress to that third stage where we're critical and in the hospital and needing ventilators and all that. These are simple things that you can at least try at home instead of just sitting at home and feeling, oh, well, I'm just going to sit here and be depressed. These are simple things that you can do. And so we want to share that with you. We know nobody else is talking about that. But these are some important things that we want you to understand that you can do to help fight against this virus.
And we'll be right back after these messages. Thank you for joining us today, and we'll see you soon on another episode of
True Health Doctors.